The man on the gurney ripped the oxygen mask halfway off and pointed at Mara Keene, as if the effort itself offended him. He said he did not want her and demanded someone else. The fluorescent lights of Trauma 3 flattened everyone into hard angles and pale skin while rain ticked against the ambulance bay doors. A cardiac monitor gave a quick, irritated burst of beeps, and Dr. Adrian Mercer, with crisp sleeves and a jaw sharper than it needed to be, laughed in the deliberate way people laugh when they want to make someone smaller in front of an audience. He dismissed Mara as just a nurse and implied that even the quiet ones could manage something as basic as starting an IV. A few people smiled because Mercer was the attending, and smiling was easier than thinking. Mara did not smile. She looked only at the man on the gurney, at the bruising darkening beneath his collarbone, the damp hair pasted to his forehead, the pulse oximeter wavering lower than it should have been, and the space between each breath growing slightly too long. She noticed the things loud people usually missed. The room smelled like antiseptic, wet nylon, and the faint copper edge of fresh trauma. The patient tried to sit forward, winced, and dropped back. He was broad-shouldered, perhaps 40, built like someone who had spent his life teaching his body to obey. His chart identified him as Julian Voss, a civilian transport from the harbor with blunt chest trauma, possible aspiration, and a possible rib fracture. There was no fanfare, no entourage in uniform, only a soaked jacket cut open by paramedics and one battered waterproof watch sealed inside a clear evidence bag. He looked at Mara again, and his irritation sharpened into distrust. He saw her small frame, her soft voice, and the fact that she had not tried to become the center of the room, and he made the same mistake everyone else made. Then his blood pressure dipped. Mara stepped closer and said quietly that he was not moving to CT. Mercer turned on her in disbelief, but Mara remained fixed on the patient and stated that his neck veins were distended and his pressure was narrowing, that he was compensating but not for much longer. The monitor quickened. The patient dragged in a breath that sounded shallow and wrong, and the skin around his mouth lost color. For the first time, his eyes found Mara's with something other than dismissal. Mercer reached for the transport rail and insisted they were not delaying imaging because their quiet nurse had a feeling. Mara replied that it was not a feeling. Then the patient suddenly grabbed at the blanket, then at the air, then at Mara's sleeve. His grip was iron for half a second and then desperate. He told her to wait and asked for help, and in that instant the room changed. Harbor Point Medical Center sat above the water where San Diego's night fog liked to drift and stall. It was a private hospital with a polished lobby, a reputation for speed, and an emergency department that ran on the oldest force in medicine, hierarchy disguised as efficiency. Mara had worked nights there for 11 months. By then everyone knew her face, but very few people knew anything about her. They knew she arrived 10 minutes early and left 5 minutes late. They knew she never raised her voice, never argued in hallways, never chased credit, and never lingered in the break room long enough to get pulled into the easy cruelty that passed for team bonding on bad shifts. They knew she wore her hair pinned so neatly it never loosened, even at 4 in the morning, and that her charting was so precise other nurses sometimes used it as a model when they were too proud to admit it. What they did not know was why her hands never shook. They did not know why she always chose the bed nearest the wall when she grabbed 5 minutes to eat, or why every time a helicopter passed overhead, her eyes moved once to the ceiling as if counting distance and weight without thinking about it. They called her the quiet nurse because people preferred labels to mysteries. In her first week, a resident had asked whether she was shy, and Mara had answered only that she was not. After that, everyone filled the silence in for themselves. Some assumed she was timid, others too serious, too stiff, too proud, or too cold. People were most inventive when they had no facts to work with. Dr. Adrian Mercer encouraged those assumptions without ever making it look like encouragement. He was the sort of physician who could speak in polished, complete sentences while ordering blood and directing compressions, which made administrators love him and exhausted nurses merely tolerate him. He was photogenic in the way hospitals appreciated for donor brochures. He remembered board members' spouses, names, and gave easy quotes whenever local news covered heat waves or holiday accidents. He had a gift for making other people's labor orbit his performance. More importantly, he hated being corrected. He rare. Lai shouted because he did not have to. His cruelty was more refined. He would pause too long before repeating something Mara had already said, translating it into a version the room could trust because it came from him. He made jokes at shift change about their librarian in scrubs probably having a guideline for everything. He smiled while handing her the least visible tasks, supply checks, overflow rooms, and patients nobody important was watching. Once, after Mara caught a medication interaction before it reached an elderly patient with a dangerous allergy, Mercer thanked the resident standing beside him and moved on. The resident had looked embarrassed. Mara had simply updated the chart. That was how she survived there, by refusing to feed the performance around her. The night everything shifted, the city was wrapped in rain that made the ambulance bay glow silver. Harbor Point's emergency department sounded like every hard night. Rubber soles on tile, wrappers tearing open, clipped questions, and the low murmur of people trying not to panic while their bodies betrayed them anyway. Mara was in Bay 8 reassuring a retired bus driver through a bout of chest pain when she heard Mercer laughing at the central station. It was not a happy laugh. It was the public kind. She finished securing the leads on her patient, adjusted his blanket, told him she would be back after labs, and walked toward the desk. Mercer stood leaning against the counter with two residents and Celia Dunn, the night nurse manager. Celia was decent in the way tired people often are, not cruel exactly, but not brave enough to interfere when cruelty came wrapped in seniority. Mercer held a trauma assignment sheet and told Mara she had harbor intake, a position that meant whatever the coast sent in wet, cold, unstable, and inconvenient. Celia offered to rotate if needed, but Mara said there was no need. Mercer admired what he called her silent acceptance and remarked that she could teach a seminar. One resident laughed too quickly, the other looked at his badge. Mara took the sheet without comment. On the counter beside Mercer's coffee sat a small silver challenge coin someone had found under a waiting room chair earlier that week. It had been left in lost and found because nobody claimed it. The coin bore a weathered insignia and an engraved bird worn nearly smooth. Mara's eyes touched it once and moved on. Mercer noticed and asked whether it was hers. She said no, but something in her face shifted so slightly even she might not have known it did. About 20 minutes later, a Marine veteran in alcohol withdrawal began swinging at the air and shouting at shadows in Bay 2. Two security officers moved in, big and tense, and ready to use force because force is what fear reaches for when it runs out of patience. Mara crossed the room before anyone asked. She did not grab the patient, crowd him, or tell him to calm down. She crouched just outside striking distance and grounded him in a low voice, telling him where he was, what the room looked like, who she was, and that he was stateside and nobody there was going to rush him. His fist stayed raised for 2 more breaths and then lowered. The room went quiet for a second in the very specific way rooms do when competence arrives so smoothly it looks simple. Mercer recovered first and praised her as if she had performed a trick. Mara replied only that the patient needed less noise, and walked away before the residents could decide whether to laugh again. At 11:43 p.m., while restocking a trauma cart, Mara replaced a frayed elastic restraint, rotated sterile dressings by date, checked the laryngoscope batteries, and then paused with her hand over a vacuum-sealed decompression tray. Not because it was missing, but because she had an odd habit of touching equipment, as if memorizing where it lived in the dark. Nurse Theo Ramirez saw her, and joked that she stocked those things like she expected to use them blindfolded. Mara answered that sometimes the lights were not the problem. Theo waited for more, but none came. The call from EMS came at 12:17 a.m. 2 adult males were inbound from the harbor. One had blunt chest trauma after a training vessel impact, the other a shoulder injury and suspected concussion. Both were conscious, both exposed to salt water, and no confirmed identities had been given beyond the names they offered at pickup. Arrival would be in 6 minutes. The words should have landed like any other alert, but they did not. Mara stilled for half a second at the phrase training vessel impact. Mercer was beside her, already turning toward performance mode. He announced that they should not make this dramatic, reducing it to a wet patient, bruised ribs, and possible inhalation, and suggesting that the harbor loved to panic over anything involving uniforms. Theo muttered that nobody had said anything about uniforms, but Mercer ignored him. Mara moved first. She opened the trauma room, laid out warm blankets, checked the portable ultrasound charge, readied blood tubing, checked the vent, suction, oxygen tree, pressure bags, and every piece of equipment with the efficient motions of someone who had done such preparation under worse circumstances. The rain intensified against the bay doors. Someone rolled in a portable warmer. Celia adjusted assignments. Mercer rehearsed confidence. When the doors burst open, cold harbor air came with them. The first patient refused a wheelchair and came in on his feet, one arm in a makeshift sling and his face set in stubborn pain. The second was on the gurney, soaked through, chest strapped, skin too pale under the lights, one hand still locked around the rail as if he would rather wrestle the bed than be carried by it. That second patient was Julian Voss. He did not look rich or political. He looked disciplined, controlled, dangerous in the way some people remain dangerous even when injured, not because they want to hurt anyone, but because their threshold for pain is so high it tricks others into underestimating damage. Paramedics rattled off the essentials. There had been a collision in rough water. The patient had been thrown against metal housing. He had brief dyspnea, unstable but responsive vitals, an inconclusive EKG, no obvious penetrating injury, and a strong preference to minimize symptoms and secure quick release. Mercer made a dry remark about how shocking that was. Mara fastened the blood pressure cuff and asked for his name. He gave Voss, then Julian when pressed for the full first name. She asked about medications, and he said none. She asked about allergies, and he hesitated just long enough to say none that mattered. Mercer remarked that they all mattered. Mara looked up sharply and asked what that meant, but Voss shut his mouth. That hesitation stayed with her. His watch bag landed on the counter beside her elbow, black, military grade, waterproof, and hard scuffed at the bezel. It was neither hospital issue nor recreational gear. Mercer began his exam with the practiced flair of someone who liked an audience. He reduced the whole case to bruised ribs and a bruised ego, promising imaging to make sure nothing exciting was happening. Voss ignored him and kept staring at Mara. Then, with the reflexive arrogance pain sometimes strips bare, he said he had asked for somebody senior. The room went still enough to hear rainwater drip from the edge of the gurney onto tile. Mercer breathed out amusement and implied the patient would survive the indignity. Mara said only that she was the one there. Voss shook his head and said again that he did not want her. It was the kind of small humiliation that lowered pressure in a room without making noise. Theo looked angry for her. Mara merely tightened the cuff and watched the monitor cycle. The systolic was lower, the pulse faster, the skin cooler. She told him his pressure was dropping. He insisted he was fine. She replied that he was not, and there was something in her voice now that made Theo turn his head. Mercer ordered a chest X-ray and CT. He wanted images before speculation, evidence he could narrate, and above all he wanted movement faster than uncertainty so he could look in control. Mara wanted him not to. The portable X-ray showed enough bruising to justify concern and not enough certainty to slow him down. A resident mentioned possible fluid. Mercer dismissed it as artifact. The ultrasound machine was wheeled near the bed and Mara plugged it in. Mercer saw her and said they were not doing a bedside echo because a nurse was nervous. Mara answered that she was not nervous. When he asked then why she was setting it up, she told him that if she was wrong it would cost 30 seconds, and if she was right CT could kill the patient. One resident's eyes moved between them like he had been dropped into an argument he did not understand. Voss shifted on the gurney and hissed through his teeth, telling them enough. Mara leaned close enough that only he could hear and asked if he had blacked out at any point. He said no. She asked if he had any chest tightness before impact. Again he said no. She asked then why he had hesitated over allergies. His eyes sharpened because even in pain he recognized a probe when he heard one. He said it was handled. She asked by whom, but he did not answer. His breathing was shallower now, not because the pain had worsened, but because the body had begun making bargains when pressure built where it should not. Mercer slapped the rail and ordered CT now. Mara put her hand on the bed and did not move it. The entire room noticed. Mercer told her to step back. Mara said he had jugular distension. Mercer countered that he had trauma. Mara said his heart sounds were muffled. Mercer sneered that she was not listening in a nightclub. Mara continued, noting that his pulse pressure was tightening and his skin temperature was dropping. Mercer thanked her for what he called bedsy. The drama and repeated that they were transporting. Voss turned his head toward Mara again and repeated that he did not want her. It would have been easy for her to step back then, easier politically and professionally, easier for the room. Let the attending decide. Let the transport happen. Let the chart speak later if there was a later. Instead, Mara reached for the ultrasound probe. Mercer snapped at her not to. She met his eyes and said that then he should do it. He held her stare for a fraction too long, and that was the crack. He did not know how to use the machine well enough under pressure. He knew enough for routine, not enough for ambiguity or for a room that might remember if he guessed wrong. Theo saw it. Mara saw it. So did Julian Voss on some instinct deeper than pain. Before Mercer could recover, the monitor tone changed. Not louder, simply worse. Voss's fingers went slack on the rail. The pulse ox dipped. His breaths turned quick and inefficient, each inhale stolen and each exhale incomplete. He tried once more to pull the oxygen mask away and failed, and suddenly the irritation drained from his face beneath something more honest, fear. He reached for Mara with both hands and asked her for help breathing. The room changed again. Mara moved before anyone else. She flattened the bed, turned the oxygen up, told Theo to page surgery immediately, told Celia to put the blood bank on standby, and told Mercer to look at him. Mercer stepped in too late to own the moment and suggested the patient was panicking. Mara said no, that he was compressing. She placed the probe herself while Mercer hesitated just long enough to reveal his uncertainty. Grainy black and white appeared on the screen, a dark rim, a chamber struggling, pressure where there should not have been pressure. The resident nearest the monitor whispered in shock. Mercer stiffened and ordered cardiothoracic. Theo said it had already been done. Voss's eyes locked onto Mara now, not because trust had arrived fully, but because his body had started trusting what his pride had rejected. Her hands remained steady on the probe, and her voice stayed low enough to cut through panic without adding to it. She told him to stay with her, not to fight the mask, and to focus on a single breath. He obeyed. More than anything, that stunned the room. Men like Julian Voss did not obey strangers when they were frightened. They assessed, commanded, resisted. Yet something in Mara's tone bypassed all of that and landed where training lived. Mercer straightened and ordered preparation for pericardial intervention. A resident faltered and said they needed the surgeon. Mara replied that they also needed a tray and opened sterile packaging. Theo moved beside her. Celia finally moved as well. The room shifted from one man's performance to a dozen people's work. The lights felt harsher, the air colder, and the monitor more insistent with each beat. Voss's hand tightened once around Mara's wrist and told her not to leave. She said she was there. The surgeon arrived in under 2 minutes and would later say it should already have been too late. It was not. The tray was ready, the ultrasound was on, the blood was hanging, and the patient had not been wheeled into a scanner where bad timing became fatal in private. One quiet nurse had refused to become convenient. The intervention was swift and clinical, all motion and precision, and numbers beginning slowly to behave again. The dark pressure eased. The monitor settled from panic to warning, and then from warning toward possibility. Mercer tried to reclaim ground by narrating orders the room was already carrying out, but nobody was listening anymore. Voss lay still afterward, exhausted beyond pride. He kept looking at Mara through half-lidded eyes as though trying to pull a name through fog. His lips moved once without sound. The surgeon stripped off gloves and asked Mercer who had caught the tamponade. Silence answered first. Theo did not bother hiding his expression when he turned toward Mara. The resident with the ultrasound in hand turned too. Celia looked at the floor. Mercer's answer took half a beat too long. He said the team had recognized instability. The surgeon replied that it had not been his question. Mara, meanwhile, was already adjusting the line and speaking only to the patient's status, saying he was stable enough for ICU transfer after repeat imaging. The surgeon narrowed his eyes at her, understood more from what she did not say than most people ever got from speeches, and told her it had been a good catch before walking out to write the note that would later matter more than Mercer knew. By 1:36 a.m., the crisis had moved upstairs and the storytelling had started downstairs. That was often how injustice worked in institutions. The emergency passed, the patient lived, and the people whose judgment had cracked under pressure began rebuilding themselves out of language. In the ICU handoff, Mara gave a report so exact it could have served as a timeline. She listed arrival, assessment, concern for obstructive physiology, escalation, decompensation, bedside ultrasound, surgical intervention, and stable transfer. She did not mention Mercer's jokes. She did not mention that Voss had refused her and then clung to her wrist when breathing became negotiation. She did not mention the half-second in which an attending physician froze because a nurse had asked him to do something he could not do well enough to bluff. She included only what mattered to the patient. That would not save her. By 2:10 a.m., Mercer stood at the central station beside Celia Dunn wearing the expression of wounded professionalism. Mara recognized the posture immediately, squared shoulders, measured voice, indignation filtered through policy language. He was angry in the administrative way, which was more dangerous than shouting. He told her she had bypassed chain of command. Theo, stocking fluids nearby, went still. Mara set down a chart and said she had escalated a change in condition. Mercer accused her of making a diagnosis outside her role. She answered that she had identified a life-threatening pattern and requested the appropriate support. He emphasized that she had done this in front of residents and staff, as though witness were the real offense. Celia tried for neutrality and spoke about teamwork issues, but what followed was essentially punishment. Pending review, Mara was removed from trauma intake for the remainder of the shift. Theo asked if they were serious. Mercer said they needed clear boundaries. Theo asked between what, competence and ego, and Mercer hardened visibly. Mara looked to Celia and asked where she wanted her. Celia assigned her to observation overflow and supply reconciliation. Mercer remarked that it was an excellent fit. The supply room was narrow, overbright, and faintly smelled of cardboard and disinfectant. Mara stood alone between stacked saline and wound care kits while the emergency department beyond the door continued its noise and rushing and fatigue. She should have been angry, and she was, but anger in Mara had always arrived cold first. She braced both hands against a metal shelf and let the silence settle until the beating in her ears eased. Then she checked crash cart seals because the crash cart did not care about office politics. She counted intubation blades because the blades did not care either. At 2:41 a.m. her phone buzzed with an internal message from ICU saying that the patient was asking whether the quiet nurse had transferred with him. The message had no sender name, probably an ICU nurse amused by the wording. Mara stared at it for a long second and then locked the screen. He remembered that much, or else he remembered needing her and hated it. Either way, he was alive. That should have been enough. The rest of the shift spread its indignities out in smaller pieces, because institutions knew how to make suffering efficient. Mercer repeated the story twice to different listeners within her hearing. In one version, Mara had grown dramatic over an artifact on bedside ultrasound. In another, she had nearly caused a dangerous delay until physician judgment sorted it out. By 4 in the morning, a travel nurse Mara barely knew was already asking whether the quiet nurse had really tried to override an attending in trauma. Reputations were damaged not by one clean lie, but by 10 careful framings. Theo confronted her near the med room and told her to give the word and he would go to Shaw. Evelyn Shaw was the overnight operations administrator and the highest civilian authority in the building after midnight. Mara told him not yet. He said Mercer was building a case. She said she knew. He asked if she was really just going to let him. She answered that she was going to chart. Theo stared and then smiled despite himself, remarking that it might be colder. Mara said it was cleaner. So she charted. Every time stamp, every vital sign, every observed finding, every escalation. The order to CT, the bedside decline, the surgeon page, the intervention, the response. She did not editorialize or defend herself. She built reality line by line in the one place institutions feared most when they were lying to themselves, the record. At 4:22 a.m., Celia called her into the manager's office. The office was all beige walls, manufactured calm, a struggling plant in the corner, and a framed mission statement about compassion, excellence, and integrity that would have been funny if the night had gone differently. Mercer was already inside. He stood when she entered, as though rising might make what followed fairer. Celia folded her hands and called it an informal counseling conversation. Mercer corrected that it was preliminary. Mara remained standing and asked what it was about. They said it concerned role overreach, communication style, and the risk of undermining physician authority during critical care. It was almost impressive how efficiently they made restraint sound like aggression. Mara asked Celia whether she agreed with that wording. Celia said she thought the night had exposed teamwork issues. Mara asked whether it had exposed teamwork issues or a preventable error. Mercer bristled and said that exact tone was the problem. Mara asked whether he meant her tone. He claimed she was implying that she alone had seen what trained physicians missed. Mara said she had not implied it. Mercer replied that she had made it visible. The room went still. He realized too late that he had voiced the truth aloud. Celia jumped in and urged everyone to step back, but Mara said no and insisted on precision. Mercer moved closer to the desk with open palms, shaping reason, and said she had disrupted command structure in front of trainees and ancillary staff, and that such behavior had consequences. Mara asked whether he would have preferred those consequences to happen in CT. His jaw tightened. Celia hurried forward with a form and said that pending full review, she needed Mara to sign acknowledgement that the concern had been discussed. Mara read it once, set it back down unsigned, and said she would sign acknowledgement of the meeting but not agreement with a false account. Mercer laughed shortly and told her she did not get to dictate language there. Mara lifted her eyes and said neither did he. The room changed again because Mercer had always counted on the mistaken belief that Mara's silence meant surrender. The moment she chose precision over submission, his advantage stopped being automatic. He covered it quickly by saying HR could handle it. Mara said then HR could handle it, and left before either of them could reshape the scene into something more convenient. By dawn, the rain had thinned to mist. The city outside the staff entrance looked rinsed and pale. Mara walked to her car with the same measured pace she used going into codes, not because she was unhurt, but because she was. Humiliation was loud inside the body even when nobody else could see it. It heated the face, stiffened the spine, and replayed the same words until sleep became impossible. Not her, the quiet nurse. Communication style, undermining authority. She sat in her car for a full minute without starting it. Her hands rested on the steering wheel. On her right wrist, just below the scrub cuff, a thin white scar caught the weak morning light. Most people never noticed it. Theo had once asked if it came from childhood, and Mara had simply said no. In the passenger seat sat a canvas tote with a paperback novel inside, and tucked into the inner pocket, the old challenge coin she had quietly reclaimed from Lost and found at shift's end. On one face was the worn outline of a small bird. On the other were words nearly rubbed smooth by years of a thumb finding them in darkness, a message that meant come back breathing. She closed her eyes while somewhere upstairs in ICU, a man with harbor water still in his lungs was waking into pain and memory, trying to understand why the nurse everyone dismissed sounded like a voice he had once heard under a black sky and rotor wash. Harbor Point called Mara into administration at 4 in the afternoon the next day because institutions preferred daylight when they intended to make something look reasonable. The conference room on the second floor had glass walls facing the bay, though the blinds were half drawn as if even the room was embarrassed by what it was about to host. Mara arrived in clean scrubs, her hair pinned and her expression unreadable. Celia Dunn was there. Mercer was there wearing a navy blazer instead of a white coat, which somehow made him look even more performative. Evelyn Shaw from Operations sat there as well, along with a human resources representative named Denise Larkin, who smiled too much before difficult conversations. Denise began with practiced softness and said it was a fact-finding meeting with no determinations made. Mercer folded his hands. Mara chose the seat closest to the door. They reviewed the event, and Mercer spoke first because men like him always did. He described a hectic trauma, praised team response, mentioned confusion at bedside caused by competing voices, and framed Mara's actions as well-intended but potentially destabilizing. He said residents needed clear leadership and that patient safety depended on role discipline. It was elegant and almost entirely false. When Denise turned to Mara and asked whether she would like to respond, she said yes, and that single word landed harder than Mercer expected. She did not grandstand or mirror his language. Instead, she opened a folder and placed 3 printed pages on the table. They were her charting with timestamps, an ICU bedside nurse note confirming that the patient had repeatedly asked why CT was delayed before decompensation, and the cardiothoracic consult note stating that the patient would likely have arrested if trans. Ported when initially ordered, Mercer's face altered very slightly. Denise looked down. Evelyn Shaw leaned in. Celia stared at the second page as if the paper might burn her. Mara continued in the same quiet tone. She recited the timeline precisely. At 12:26 a.m., she had reported neck vein distension, muffled heart tones, narrowing pulse pressure, and skin cooling. At 12:28, transport to CT had been ordered. At 12:30, she had requested bedside ultrasound. At 12:31, the patient had decompensated. At 12:32, cardiothoracic surgery had been paged. At 12:36, intervention had begun. Mercer cut in to say that a nurse could not independently diagnose tamponade. Mara replied that she had not diagnosed it, only recognized obstructive physiology and escalated, which was within her role. Denise asked Mercer whether bedside ultrasound had been available before transport was ordered. He admitted it had been available, but argued that whether it was indicated remained debatable. Mara slid forward another page and said that the resident assigned to Trauma 3 had asked her afterward why CT had still been considered with those findings present, and that she had told him to document his own observations. He had done so. Now Mercer was no longer smooth. His eyes flicked to Celia and then to Evelyn, calculating. Institutions often protected hierarchy until hierarchy left fingerprints. Evelyn Shaw sat back slowly and said a broader review might be necessary. Mercer recovered enough to say he welcomed that, because men who had rarely faced consequences often confused scrutiny with theater. The meeting might still have drifted into administrative fog if not for the knock at the glass door. A man in a dark suit stood outside with the stillness of someone who did not ask for space, because space had spent years learning to make itself around him. Beside him stood 2 others, one in military dress khakis and one in civilian compliance attire holding a tablet and a thin black folder. Evelyn rose so quickly her chair scraped and asked if she could help. The suited man opened the door himself and said that she could. He introduced himself as Commodore Elias Grant. Nobody in the room except Mara kept their expression fully still. Even Mercer stood. Grant's gaze moved once around the conference table, not like introduction but like assessment. He was in his 50s, broad-shouldered without softness, gray at the temples, his face marked by weather and command rather than vanity. The officer beside him said nothing. The woman with the folder gave a brief professional nod. Evelyn stumbled into a statement about not having known he was coming. Grant told her that she knew now. He looked at Denise and said that they were welcome to continue. But before anyone memorialized the wrong version of the previous night, he needed access to the hospital's EHR audit trail, security timeline, monitor data, and all event statements regarding Julian Voss. The room chilled. Mercer maintained composure by force and noted that Voss was a private patient, hinting that he was not sure how such access applied. Grant turned his head slightly and informed him that Commander Julian Voss was under his command. No one spoke. In a single instant, what had looked like a workplace dispute became something much larger, a documented near failure involving a patient connected to institutions Harbor Point had not realized it had brushed against. Commodore Grant did not demand explanations immediately, which made him more frightening. He asked for facts the way surgeons asked for instruments, only what mattered and in the order it mattered, with no patience for decoration. The compliance officer, Audrey Lynn, set down her folder and requested read-only access to the hospital record. The officer in khakis introduced himself as Lieutenant Commander Hale, medical liaison. Evelyn became nervous hospitality. Denise seemed relieved to let someone more powerful in the room. Celia looked sick. Mercer kept trying to reclaim professional footing by emphasizing that Commander Voss had arrived without military identification disclosed at intake and had therefore been treated clinically based on presentation. Grant nodded once and said that was what they should have done. Mercer seized on that too quickly. Grant looked back at him and said that the sentence had a second half in his head and advised against speaking it. Mercer went quiet. Grant asked to see the trauma bay, so they walked. The hallway lights were brighter in late afternoon, and the day shift was busy enough to sense drama without understanding it. Nurses stepped aside. Residents pretended not to stare. Theo, returning for another night after short sleep, saw Mara flanked by administration and military brass and nearly dropped his coffee. Trauma 3 looked ordinary again with clean sheets, restocked cart, and a dark monitor, a room stripped of evidence except what memory could still hear. Grant stood at the foot of TH. He bed and listened while Audrey Lynn asked questions. Who positioned the ultrasound? Theo answered before Mercer could, saying Nurse Keene, who requested surgeon escalation. Again Nurse Keene, who ordered CT before decompensation. Mercer answered himself, saying he had, based on incomplete information at that point. Audrey typed something. Grant walked to the side counter where the patient belongings tray had been kept and asked where the watch had been. Mara answered before she could stop herself that it had been bagged there. Grant turned to her and asked if she had noticed the watch. She said yes. He asked how. She said it was not recreational. He studied her face for a second and agreed that it was not. Mercer tried again to recover authority by suggesting that while they appreciated the sensitivity of the commander's status, the clinical issue had already been addressed. Grant looked at the gurney, the monitor mount, the floor, as if reading motion from the room itself. Then he said calmly that the clinical issue was not the only issue. He moved toward the supply cart and let his fingers brush the top drawer, the ultrasound cable, and the decompression tray slot. Then he asked Mara how long she had worked there. She said 11 months. He asked what she had done before Harbor Point. She answered that she had worked at a regional hospital in Monterey. He asked what had come before that. Mara said military. Grant asked her specialty. She answered that she had been a corpsman and then nursing. Mercer released a small breath that almost sounded like relief. Prior military was common enough near San Diego, he thought he understood. Grant kept looking at Mara. He asked where she had been attached. The emergency department seemed to lose sound. Mara answered after the smallest pause that she had been attached where needed. Theo blinked. Mercer's relief vanished. Grant gave the faintest nod as though an old code had just been answered correctly. He said nothing more to explain it. Instead, he told Audrey Lynn to pull the amendment history on Dr. Mercer's note and the resident note timeline. Mercer stiffened and asked whether they were implying chart manipulation. Audrey answered only that she was requesting an audit. Mercer said that required cause. Grant finally looked at him with something like judgment made visible, and said that a patient had nearly died while a nurse with sharper assessment than the room was being mocked for speaking. And if Mercer needed a word for cause, he should start there. No one argued after that. The emergency department breathed differently. People who had dismissed Mara all week began re-examining every memory they had of her, the veteran she had grounded without force, the way she always positioned herself to see exits, the old scar, the coin, the clipped answers, and the fact that she never looked impressed by swagger. Mysteries remained invisible only until a powerful person treated them as known. Theo found Mara near the med room 10 minutes later while Audrey and Grant reviewed records with Evelyn. He asked in a whisper what exactly was happening. Mara was labeling syringes for the night shift with the same calm handwriting she always used. She said it was a review. Theo told her not to answer like none of this was insane. He pointed out that a Commodore had walked into their hospital because of her patient, asked about her background as if he already knew it, and that Mercer looked as though the floor had been replaced with water. He asked who she was. Mara held his gaze for a beat and then gave the truest, least useful answer possible. She said she was a nurse. That would have been the end of it for another hour if ICU had not called down with a message no one expected. Commander Voss was awake, and he was asking for Mara by description rather than by name. He was asking for the quiet nurse. The ICU was dimmer than the emergency department, built for recovery rather than velocity. Evening light had turned amber against the windows by the time Mara stepped out of the elevator with Commodore Grant, Audrey Lynn, Evelyn Shaw, and Mercer following, because he could not bear to be left out of whatever story was forming. The corridor smelled faintly of clean linen and chlorhexidine. Machines pulsed behind glass. A nurse at the desk looked up, recognized Grant, and straightened so quickly her chair squeaked. She directed them to room 12. Before they entered, Grant touched Mara's sleeve once, lightly enough that nobody else might have noticed, and told her to say nothing she did not choose to say. She gave the smallest nod. Inside, Julian Voss looked less invincible and more dangerous precisely because the illusion of invincibility was gone. He was propped partway up, color returning but not all of it, chest banded, lines in place. Every movement controlled the way strong people controlled pain when they refused to let strangers witness too much. His eyes moved first to Grant, then to Mercer, then to Mara, and everything in his face changed. It was not recognition all at once. It was something deeper, shock crossing a bridge toward certainty. For a moment nobody spoke. Then Voss, with a voice rough and little more than breath, said a single word, Ren. No one in the room understood it except two people. Grant's jaw tightened once. Mara did not move. Voss blinked slowly, as if surfacing through years instead of sedation, and kept his eyes fixed on her. He said he had known it was her voice. Mercer, misunderstanding completely, attempted to explain that this was Nurse Keene, part of the treatment team. Voss never looked at him. He said he knew exactly who she was. The ICU monitor continued its patient rhythm. Somewhere in the hall, a cartwheel rattled over a threshold. Inside, the room time narrowed. Evelyn Shaw asked carefully if he could clarify for the review. Voss drew a controlled breath that clearly cost him and said that they had sent the only person in that trauma bay he would trust unconscious. No one moved. Theo would later say the silence in that room felt like the pause in a dropped tower before release. Mercer attempted a smile that collapsed halfway and suggested the stress of the event might be distorting things. Grant cut him off with a glance so final it looked physical. Voss kept looking at Mara and said she was supposed to be gone. Mara's first words to him since trauma were level and painfully simple. She said she was gone. He replied that she was not gone enough. There was no romance in it, no melodrama, only history compressed so hard it sounded like accusation and relief at once. Audrey Lynn spoke gently and asked whether he had known Nurse Keene before admission. He said yes, from years earlier. She asked in what capacity. He looked back at Mara, and it became obvious that whatever answer came next belonged to her as much as him. She gave the slightest nod. So he answered. He said that she had kept 6 of them alive on a black beach nobody was supposed to remember. Nobody in the room breathed. Mercer actually gave a small laugh of pure disbelief and asked what that even meant. Grant turned toward him and explained with clipped precision that it meant the nurse he had treated like a decorative accessory had once been the combat medic attached to one of the most difficult maritime teams on the coast. Mercer's face emptied. Theo, who had edged into the doorway with a med sheet in hand, felt his entire understanding of the previous 11 months collapse and rebuild at once. Voss's voice was quiet but carried when he added that her call sign had been Wren. In that moment, every breadcrumb snapped into place. The precision, the stillness, the veteran she had calmed without force, the way she memorized equipment by touch, the scar, the coin, the way she spoke under pressure like panic was something that happened to Weather rather than to her. Wren was a small, harmless-sounding name, exactly the kind that survived in memory because it advertised nothing. Harbor Point finally understood that it had not hired a timid nurse. It had hired a woman who had already spent years doing impossible work without applause. Voss rested after that, but not before Audrey Lynn asked the question that would turn awe into consequence. She asked whether in Trauma 3, Nurse Keene's assessment had affected his willingness to remain in place when transport was being prepared. Voss answered without hesitation that it had. Mercer opened his mouth, but Voss cut his eyes toward him and stopped him cold. The commander's voice was still weak, but whatever lived under it was not.